with your power, your story might change. Cause no condition is permanent. Yeah. 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 Shout out to you, white priest. Why you came man of the moment? I salute you.
The Society for Good Democracy 98.1 FM. We are now going to Studio 2 and bring you the program World Body Talk. Stay tuned.
Radio Democracy, the true voice of the people.
Good evening and welcome to the program World Body Talk. They come to you every Thursday from 5 to 6 o'clock. Inside the program World Body Talk, they talk about different sickness, within the cause treatments, signs and symptoms and prevention. We always get experts them at the studio for talk about different sickness. And inside the edition of the program World Body Talk, we studio guest Dr. Lloyd Harrison Williams, consultant ophthalmologist, and Dr. Fatmata Kamara, we the ophthalmology registrar, ophthalmology department na the University of Salon Teaching Hospital Complex. And today we talk about glaucoma blindness. How can it be prevented? Member say me they bring you this edition. Musa Kamara na my name. And the member say yourself can listen and watch we live na Facebook page. You go get chance for take part of the program through the number 0779819881. And later we open the phone line. We say yourself go call and make a contribution inside the program on the glaucoma blindness for prevent them and within an experience bottom. As I mentioned earlier, my studio guest today now Dr. Lloyd Harrison Williams and Dr. Fatmata Kamara. But I want to welcome Dr. Lloyd Harris Williams at the program, as we'd expect Dr. Fatmata Kamara for joining me anytime from now. Well, Body Talk. Good evening, welcome.
Good evening.
Yes. Okay, and I don't know if I get them right. The issue of the ophthalmologist, is that correct? Ophthalmologist. Okay. I will try for Lanham and offer with them as time to go. The program now will Body Talk. It comes to you from 98.1 FM. Of course, you don't listen to the program, and you don't follow. No say we get quiz based on we last program. Through we partners, we at the University of Salon Teaching Hospital Complex, we can always give out top up of 50 leons to we listeners thing, and we can ask based on the last program where you answer, you will get 50,000 leons top up. Last week we give away 100,000 top up to we listeners thing. This week again through the University of Salon Teaching Hospital Complex, we get set of questions the Moody can ask. Where you answer any one of them, you will get 50,000 leons top up. Yeah, of course, we can do it before program starts, proper one. And today we ask, what are some of the, as we look at kidney, we ask, what are the two things them where they unbog the kidney? Name two things them where they unbog the kidney, or two human behavior where they unbog the kidney. And almost liter water somebody way healthy for drink per day. As you were the followed program last week, the doctor talk about you were not diagnosed with kidney problem, you get a certain amount of water when they recommend for make you drink. But you were normal, you okay, you get certain amount of water way for take for the day for keep the kidney and the body organs them healthy. Waiting at that amount of water they way for drink. And waiting at the name of the doctor for last week program. Waiting at the name of the doctor and in position for last week program. And safe waiting have been with topic. Waiting have been the full topic. The program Well Body Talk 77981 call and answer any one of them questions there. So you go win yourself 50,000 leons to pop. We get first caller on the line. You never said the call from.
Yeah, the call from Gambia district, Mambolo.
Okay, from Mambolo, Gambia. Which one of the questions they want answer?
Well, I want to answer question 2.
Question 2?
Question 2, yes. I'm also a particular person you have already picked.
Yes.
That's 3 to 4 liters.
Okay, that's quite correct. You don't win yourself 50,000 leons top up. After program immediately, we will send the credits. I don't take your number down. Congratulations from Mambolo, Kambia district.
Thank you, sir, Mr.
Okay, welcome. I'll get another caller on the line. Yes. You know where said the call from?
Yeah, the call from Congo Cross right now.
From which side? From Congo Cross. Yeah, it's the contribution. Which question you want to answer?
About the kidney, directly about the kidney.
Yes, name 2 things where they unblock the kidney.
One, the alcohol.
Yes.
Excessive drinking of alcohol.
Okay.
Then, 2,
With a listen, you don't name one. Hello?
yes, sir, I did get you now.
Yes, with a listen, and you don't name, you don't start for name. Continue. We say 2 things where they unblock the kidney. Hello? We still await.
Yes. Then, energy drinking.
Okay. Alcohol and energy drink. You correct. Congratulations.
Yes, sir.
Okay. We get one more call who they pick. You never said a call from Well Body Talk.
How are you?
I did do fine. Which one of the questions they want answer? 1 and 2 don't go.
Printer.
Yeah, Quater.
Yeah, the question, the doctor in name.
Yes, what did the doctor name last week?
Name doctor. Yeah. Kamara.
Okay. Yaya na the surname. The guy name before that.
Hello.
Yeah, they get you. Yaya na the surname, but you get one name before that.
Sorry. Hello, yeah. Doctor, yeah.
Yaya na the surname. You get one name before that.
All right, okay. And then Doctor Mohamed Yayaba. Doctor Mohamed Yayaba.
Okay.
Hello.
Yes. Go ahead. I don't listen.
What are the question again? What are the other questions?
In name, the doctor in name and in position.
Okay, now doctor of internal medicine, University of Sierra Leone Teaching Hospital Complex.
Okay. Your number na 0. Okay.
The number
with
is 034 513.
No, it's okay. I dey take calm down. Congratulations. We dey give that to you. The doctor last week, now Mohamed Yayaba, now resident doctor, internal medicine department, University of Salon Teaching Hospital Complex. Congratulations.
Thank you very much. Thank you very much.
Okay, we don't get we winners there. Yes.
Hello?
Yes.
Last I call and beg the answer, but I'm not getting to cover, so I'm not getting to cover.
Sorry about we send it to pop, then maybe the number they mixed up, so we don't take another step now. As we they call, we they take the number and we
925.
yeah 034-513-926.
925.
Okay.
034-513-925.
Okay. 513-925.
Yes.
513-925. Okay.
Yes, sir.
Sorry, we almost missed today again.
All right.
We go send. I will call you after the program.
All right. Thank you very much, sir.
Welcome and congratulations, and thank you for always keep them locked to Radio Democracy and Well Body Talk.
Bye bye. Yeah. Thank you.
Okay. Thank you very much. The program Well Body Talk, and we need to pick calls again because we don't exhaust right now. We money don't do all the questions they don't answer. We can add more to the questions there so for raise awareness about well body and how we could contribute to your little way. If you the out there want sponsor this program, because this one now from University of Salon Teaching Hospital Complex, and they can limit out to 2, but we don't go overboard today. We make it 3. We were responsible for that one day because of the way people be committed for answer the questions there. If you the out there want fund this program, we can able do a sponsor, so we will give more prize to people for draw people attention to things them what they discuss there for help the well body system in the country. The program Well Body Talk, they continue. We go for this break welcome with the start the edition of the program. And the quiz they start right from here. Listen attentively. What will they discuss today again? Next week will they ask about them and you will get a chance for able call and make your contribution. We go for this break welcome. We continue the program Well Body Talk.
No condition.
The condition is permanent. Yeah.
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 Like we are living, my bedroom is full of so much surprises. You may be up and feel no one like you. In my bedroom, no one knows tomorrow. Never look down on anyone. Let's be there for one another. 'Cause today is me, tomorrow might be you. 'Cause no condition.
The condition is permanent. Yeah.
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 This is Chiban's music.
Laughing at someone's situation, not knowing we are all God's creation. But one thing I want them to know.
Yes, indeed. The program Well Body Talk. They continue. We just done the quiz section of them. We get 3 winners for today. Congratulations to them. You listen attentively. Maybe yourself could be the next lucky winner. Today edition of the program, we did talk about AI, and we get experts them at the studio. We go can help we talk about AI and how we go able to prevent this glaucoma blindness. I get to specialists or experts them at the program. I get Dr. Lloyd Harrison Williams, winner consultant ophthalmologist, and also Dr. Fatima Kamara, winner ophthalmology registrar, ophthalmology department, and the University of Salon Teaching Hospital Complex. Then two Master Sabi people that they take me through the topic for today, winner glaucoma blindness and how it can be prevented. Before we can look at the glaucoma blindness, I come to Dr. Harold Harrison Williams. When we talk about ophthalmology, what thing would they talk about and what in the departments they do?
Okay, ophthalmology. What in this big name mean? It really mean a study for eye business. Okay, so now all about the eye business. How we go able for go and get help for any eye condition where you suffer from. Yeah.
Okay.
And the Department of Ophthalmology is na Connaught Hospital, but we get eye departments them or eye clinic them or eye units them where they all side na the country, at least all the districts then are the country now. every district hospital get one eye facility dey now. Even to the new districts Falaba and Karine, we get eye hospital then dey. Yeah. Okay. So we want to make people make use of the opportunity where they don't be given, because we dey use we eye for do boku thing.
Okay.
But even for plan, but we dey fail for plan for we eye. Now so we on boss can talk Dr. Matthew Vandy. So I want to make we all try for plan for we eye.
Okay, and you don't talk about the office, you don't talk about some of the things that they do. I want to take you deep down to this topic of discussions before we come to we other experts in the program. On Radio Democracy, for over 2 years now, we don't partner with the University of Salone Teaching Hospital Complex. And one thing we don't do now for give experts them always for talk about different sick them, raise awareness about well body. And Radio Democracy don't they provide in airspace for this program at free of cost. And now we don't begin a quiz for to winners them. We open up to sponsorship and support. You self they listen to the program, you win the follow up, and you see the level of retentive memory people don't take for listen and learn from the program and how they answer to the questions. Then first 3 winners win everything at a go. Yeah, I see they shake it there when they answer the questions there. And you surprised for know that people get this kind of awareness about some of the things the moon they can talk and reach you and they learn from them.
Really, it really shows say una they do a wonderful job, and we want to make una continue for do this kind of thing. We people they need them, because I tell you, people and they suffer unnecessarily. Yeah, boku things and the way we they suffer from way it be say we came for prevent them. If only people they know. But how people for know nine the thing, yeah. So really we appreciate, and we know they take lightly the opportunity where una give it so for come and can talk. But a very important thing for your business we call glaucoma. Okay. Glaucoma.
Okay.
When they can call the silent thief of sight.
Glaucoma. What would they talk about when they talk about glaucoma blindness?
Yes. Glaucoma blindness now one in which in salon is so common where people do not understand, but yes, it's common. Now the second leading cause of blindness, and the only one we beat them na cataract, where they can call jige, keleng, Okay, so glaucoma in blindness in not the reverse. So it be say him na the leading cause of blindness when not the reverse na salon. So you understand with how important it be. And you see the name when they come, the slogan, they say na the silent thief of sight. Thief man, where they thief you safu, you know they know nothing. Until we don't late, now so glaucoma. We don't late, now that time you notice say blindness don't start to come. We don't late too.
For we listeners then, how somebody go notice say this na glaucoma blindness this person they suffer from?
Well, you know what's na glaucoma? It be say the way eye they happen, it they damage the nerve. The main nerve, the connection with it to from the eye to the brain. You can see people and then they see fine one. Well, the eye look clear.
It open.
It look clear. So you know they see like a jege, you go see white in the eye. But for glaucoma, the eye clear. But the person not they see at all. You can feel a form in the form like I say, not they see not so. But yes, now so glaucoma they affect person. When it starts, you know they know nothing. Now that is not the bad thing. You know they know nothing. Most of the time, you know they know nothing. Until when you don't let. Now that make them say, in the silent thief of sight. Because when it starts, you know they know nothing. You dey go about your business, small. Waiting they happen when it starts. The nerve, the damage, small. That connection, what I don't say, from the eye to the brain. And when it damage the nerve, waiting they happen, this now we call it the optic nerve. Where the damage now you side vision. Now him actually they go. Where they look person straight one. Now you central vision now they use. But once they look at somebody, you will realize say if it's something they pass around, you don't notice. Sometimes you no go no particularly waiting, but you know say something move around you. Not so. Well, now the side vision then we can call it peripheral vision. Well, in glaucoma, now then the nine force they start to take away. So when one eye open, in get your peripheral vision. Where small it they go. The other eye, if it inside open, it help you for cover up for that side vision day. So you know they know nothing. Well, one eye na ink lead the other one. Glaucoma most times the kind way common as salon na the one way that affect all to the eye. Yeah. So one eye can dey before the other one. So by the time wey one eye dey make for blind, wey you notice say wey something dey comot from that side dey wey that eye dey, you no dey see am until e can confront you before you see am. So that when you notice that day, e be say the other eye himself dey falla. It's just that him better pass that eye the way don be affected bad
Is
one.
it possible that or two eye get or one can get one no get?
Well, and then we dey talk. So most of the time, the one wey come on wey na bis one wey be say e dey pass on from parents to dem pikin dem, you understand eh? E be say e dey affect all to the eye at the same time. Yeah, but one eye can always dey before pass the other one. So na that dey make people then can realize say na one eye first dey blind, then the other one can fall out.
You na consultant, and we mean say you don't take way they deal with these issues. We go come back to you for look at wetin are some of the things them we responsible for this condition here so, and wetin are some of the things them we for do for prevent them. And in your name na Lloyd Harrison Williams, consultant of ophthalmologist na from the University of Teaching Hospital Complex, and also we get Dr. Fatmata Kamara, we na ophthalmology registrar from the ophthalmology department na the University of Teaching Hospital Complex. You don't get Dr. Lloyd don't lead the basis of glaucoma, waiting actually na this thing. You come up from the center where they treat them sick. How common and how often una can get cases of this in this country?
Well, if you say how common, if we take like 10 people, 7 to 8 of them people in day, they get glaucoma. Out of the 10 patients that they come, 7 to 8 they get glaucoma. So that now how common glaucoma they now we can't say. Do you understand? And one thing where people in can normally they know they come for can check for glaucoma. Now other eye condition they call them. For instance, then eye the arts. Come say la can check because eye the arts. So now then they can call with them. And we they find out say where they come with that eye arts day or something the eye they read they say la can hospital where you can check it gets glaucoma. So that now the things that we they call them. Not to foresee them, we just can say I come for glaucoma checkup. Now other eye condition can call them. And the common one then person eye the arts, the eye the red. They pull water and I can say like I can check my eye. So where you can check the eye and I find out say this person don't get glaucoma for a very long time.
How you can differentiate glaucoma from other eye conditions them or other eye sick them?
Okay, so if we get a patient where they come, for instance, a car with an eye red, right? Now we can advise and say, as you begin get complaint with your eye, you begin feel your eye, can a hospital. Because when you can a hospital, we they check you. We get different tests that we will do for you. For instance, these patients come, first thing first, as he enter, a register, he gets a green card. We they do in visual acuity. You can find out, so what's in a visual acuity? We want to see how far these patients they see. We check how they say the vision they reduce. Then one, they will say, okay, let we check the eye pressure, what we can call the intraocular pressure. The normal one for the between 10 to 21. But when they check the patient, you can find out say either some can get 30, some they get 35. That are all a signal for sure say something they go wrong a part of this red eye. Then now we can take the patient, we watch her under the slit lamp. That now we mention what they use for check the front and the back of the eye. The back of the eye, would they able see the optic nerve like when me boss they say just now. What they found out say this nerve don't begin damage. We get what we call cupping. That means the nerve the cup go down, it they begin damage. So this now all things that we they point out to glaucoma. And you see, say the patient not come for glaucoma, now ready eye can with them. But we don't go through all we check them, we can diagnose and say it gets glaucoma. So now so we they take for pick up with patient that we get glaucoma.
This sick plenty in a salon?
Plenty. Like I say, out of 10 patients them, 7 to 8 they get glaucoma.
Where they go for eye?
Where they go for eye checkup, yes.
So I think glaucoma by statistics where you don't give now the highest, then they cause the highest eye problem. Yes,
okay.
William? Doc?
Yes, waiting doctor they talk important that you know say not to say now so they exist now the population,
population,
but now the one that
where they come for the
they come,
yes, now the
yes,
yai department
yes,
we dey talk about,
exactly.
yes, the one where they come for the
Yes.
yai department,
Yes.
like me I read,
Uh-huh.
and out of 8 out of them 10 or 7 out of them 10, then they can say, or they result to glaucoma.
So now based on the experience,
The eye problem.
yes.
Yes.
But I want for also make you know say for the population, if you want to understand, we do a study in 2021, and it shows say we do the study among people 50 years and above. We call them the rapid assessment of avoidable blindness, and it shows say among that age group, the 50 years and above, 21.7% of them people where we check then get glaucoma, and
21.7%
Yes.
of 50 years and above.
yes, get glaucoma. So now the reality then we really did not the population.
Is it we they can look at the cause, but is it age a risk factor?
Well, one thing way you for understand na that yes, as e be say you dey go older, e possible for make you get a chance for make e don show up by that time day compared to where you younger. But even when pikin small, even when e comot na mama belle, e can get the glaucoma, e can show up with am. You don see pikin born, e high, e big. E wey be say e mama and papa dem no necessarily get big that eye wey look big, but im own eye big, and sometimes e no can clear like how you dey look the black of the eye you see e clear. Sometimes e can make white hazy, so that dey can show say most probably e get glaucoma. Yeah, and we call am bull's eye, ophthalmos. But wetin we dey try for talk na that pikin dey wey can born with the sickness. Na sickness wey e be say e can pass on from parents dem. Sometimes dem dey you go say this parents here e no get glaucoma, we don test am, I no get am. Na true, but e get the gene and e possible for make e still pass am to a pikin dem. Yeah.
Okay.
Okay.
What are the cause?
The causes of glaucoma.
causes of glaucoma.
Yeah. So the gene, you see, we get special gene dem wey dey wey responsible for the way how the eye dey form, and one particular structure dey na the eye wey e be say we call am the trabecular meshwork. E want like sifter. Water dey form inside the eye. Normally, God by his sense, blood no dey go middle the center part of the eye. Na plain water, e dey comot from same blood, but e dey filter all the cells, all the proteins. So na plain water wey get all the yam there wey the body need for inside the eye. Na im dey flow through middle the eye. Otherwise, na red normal you for dey see all thing because the blood go get the blood dey color. But na clean water na im dey flow na the eye, we call am aqueous. But that day wey dey flow, how e dey flow wey dey form from blood, na so e for dey drain back into the blood. You see, so the rate at which e dey form na so e for drain. But if you see e form faster pass how e dey drain, most times na the drainage na im dey slow. Not to say the formation na im dey high o, but if you see the drain slower pass how e dey form because that sifter dey block, or the way how God make am because of that gene, e no get enough hole for make e drain fast, then na dande can predispose most of young people dem wey we dey see na salon to glaucoma. Yeah, but also some people dem in other country dem the angle outside the water for flow for reach this sifter, this trabecular meshwork, himself e can shallow, so that angle the way is small too much, e dey cause resistance to the flow for make e drain through that sifter, and himself can cause the glaucoma for happen.
Is it the race? It affects by race?
Yes. You go find out say the type of glaucoma wey common for we black people dem call am primary open angle glaucoma. Like how they talk na the sifter wey dey na the angle na im no get boku hole dem most of the time na im can cause the glaucoma wey we dey see. So the drainage dey slow. But for Asians dem, the one the way yes, then Chinese dem people and they we can see say the one wey na the close angle, the angle itself na im dey small, is shallow, so na im can cause their own glaucoma. And then glaucoma, some of them in can better small bit because their own it can come sometimes with acute pain, redness, vomiting. So that they make the rush go to hospital because of that, and when dem go pick up say na glaucoma cause am. But we own when at this primary open angle, e no dey give non-sign, non-symptom at the beginning. So tey we don late, we don advance, na that time e dey start to show small sign dem wey if you conscious no more, you go realize say wey possibly dey comot from the side wey the eye wey be affected most. You know dey see am quick, so tey e can front you before you see am. Well, that time if we pick am up, we go check the nerve, almost like I say the nerve don almost damage pata.
So apart from this gene and also the race,
Yes,
we
but
na risk factor. What other causes them?
But what that cause them dey, yes. One of the things na that when you can born, you understand, you can born with some other conditions, eye problem them. The one the way they use glasses, especially we can say now short-sighted people. Then they see something where they near, but something where they far, they know they see them. They're more prone for also get this glaucoma. Yeah, people the way be say they can get trauma, something knock the eye. They not take and serious self. That eye dey wey the thing be knack, you get high chance for making self develop glaucoma because like how I don talk, when they knack you trauma, it dey cause inflammation and that carbohydrate measure that sifter it can block because of the alpha proteins then where they go settle the yansan and then they can predispose you for let the pressure high that day. If you don't know, you're not going to hospital for proper treatment, then they can cause the glaucoma. You see, and the pressure sometimes it can go higher one. It can go up to them 50, 70. And then if the pressure high like that, inside 2 to 3 days, it's possible for make you blind because of that. So do you will take with the big people then small thing that we can happen where they knock with eye. We will know they take and serious. They are taken serious.
You go buy eye drop, put under the eye.
And then eye drop the way then they buy back. For example, this when that thing that they can be most times then they go buy eye drop when na steroids based. For example, them beta N, Ciprodex. Then kind eye drop then get something we call steroids, corticosteroids. And when you use that kind eye drop day, na the eye, some people and they way genetically then self they react to them. The pressure na the eye they go up. We call them steroid responders. So that kind of eye drop they can cause the blindness. You see, and people then can fashion for user, especially where the eye they red. That allergies where we can call Apollo. Where you see you get a number, you just go now pharmacy. Pharmacy not to for just go there and treat you, not to down there then they for. Now for let them you go after you don't go to hospital, they don't prescribe the medicine that you take and now you can't go to the pharmacy, then go then give the medicine where the right are they. But you they go there for buy the medicine normal just because you get condition and then they will just give you medicine for every symptom where you complain. And if they give you eye red, that inflammation, then give you that steroids there because anti-inflammatory, but it gets side effects. Yeah, it can raise the pressure and can cause blindness.
Will they come back to you, Dr. Lloyd Harrison Williams, consultant ophthalmologist, and I don't know the program where they talk about glaucoma, blindness. We'll come back to you. Will look at preventive mechanisms, how for prevent them. Dr. Fatimata Kamara from the ophthalmology registry, ophthalmology department and the University of Salone Teaching Hospital Complex. Una dey at the center. When they don't diagnose person with this condition, what is the first step we will do?
Well, if we get a patient, we don't diagnose some of glaucoma. We get one where they cancel the patient because glaucoma treatment, not a treatment where you they start, you left. We go for cancel explain GAM, waiting a glaucoma, making get that understanding of the disease, so it go take them serious, and you know go just start treatment it left because when you start treatment with glaucoma, a lifelong treatment, just like hypertension.
So and the men?
No, you not get medicine. Now manage with the manager.
But if somebody get glaucoma, you go totally blind. Is it possible for make you to see AFAF through the treatment? Yeah.
No, if you get glaucoma, you come to where you already know they see light. That means you didn't at the end stage. And like where we say glaucoma, they cause irreversible blindness. If you don't cause damage, that damage they know they reverse again. So now make with the advice with people and say, come quick. Where you are at you come.
So take me through the stages of glaucoma and who stage somebody for the wait for going to hospital or we advisable for making go to hospital?
Well, if you eye begin at, you need for Kana hospital.
In any condition?
Yes. Come let them check your eye. You know say glaucoma no they you know get one particular symptom for say this we go point out in a glaucoma. Maybe that your eye so you get now one way for let the eye tell you something they go wrong. Come check your eye. Now when you can a hospital, doctor see you, he examine you, then we gonna say this na glaucoma. If you then na a early stage, we mean say the sick just starts. You start your medication, that the eye drops. We go able manage. You dey manage that vision now where you get, where you no go blind for a very long time. But if you come where you know they see light again, that means say that yeah, they will not get much help. Do you understand?
Yep.
So early diagnosis is very important in the management of glaucoma.
The treatments we make mention of now one, but many times people can say forget access to some of them treatments are difficult, and even forget access to medical to experts them on then particular sick are difficult. How it are like na the University of Salon Teaching complex.
Well, that not just a misconception where they get.
Okay.
Where you come, connect. We get doctors then they. We get ophthalmic personnel then they, ophthalmic nurses then they. Where you come, we they see you. We did it from morning till. We not get specific time. We did it. Where you come, we they see you. Any patients where they come, doctor they see them. So when you come, we'll see you, we diagnose you early, you start your eye drops, we they able manage that vision with all left. It go able help you, reach to that end stage.
This kind of treatment, is it only for Connaught Hospital or is it across the country?
Yes, as my boss be they say, we get ophthalmic personnel them all over the country. Even in the districts, we get ophthalmic personnel then they. So you get problem, go even once in a year, even if you not get no eye problem, but they always advise say once in a year, just go, let them go check your eye. Because glaucoma, it not can get symptoms when in the start. So once in a year, go for an eye check.
So because another one ask you if there is any signs and symptoms say, oh, this issue will not begin happen to person, so now glaucoma, you need for rush for go hospital for go reports.
No, with some people, especially in we own settings, Sierra Leone, waiting we find that we they see now frequently, people that can come, they know they get no symptoms. Now for we people and where the eye at, then they gonna go to hospital, eye red, eye they scratch. But for glaucoma, with some people, they get no symptom at all. You eye clear, you they see, they get no symptoms. Now where it don't begin reach the end stage, where you want lost your central vision now the tenant will say, oh, I know they see fine, like go na hospital. And then send them now, you don't reach that end stage.
Okay. The program now Bodi Talk, it comes to you from the Society for Radio Democracy 98.1 FM. You just listen to Dr. Fatmata Kamara. We now of Fatima.
Yes.
Okay. Fatima Kamara, we now ophthalmologist, registrar ophthalmology department, University of Salon Teaching Hospital Complex. And you self with the listen can call now on 077 981 981 077 981 981 and ask any question at the program as we get experts them. The program will Bodi Talk, they continue. I come to you, Dr. Lloyd, and make we look at way for prevent this sick. It preventable?
Yes. That's not very important thing we want for promotes now. Yeah. Now that though this sick here, a blindness is not the reverse, but it became for prevent. Let reach that stage there. In fact,
we'll get a caller.
Okay.
Before we can look at the steps them for prevent them. You never said the call from? Okay, we lost that caller there.
So the most important step they say, no wait so till you are at. Once inside the year, take chance. Go let them go check you. If when we get motor car, we get bike. We know the wait so till you get problem. Will they go maintenance?
Okay, we get caller on the line. You never said the call from Bodi Talk.
Hello, good afternoon.
Good afternoon, Bodi Talk.
Yeah, I'm meaning this group is quickly when I'm looking at the name of one of these GGWiki common people there. When I just over the name, there's people that go there.
Okay, if you've been enjoying the program earlier, I'm going to say glaucoma not to JG and the doctor being differentiate them earlier. But if you just join in and you get concerned about that, you go over that again before the program end. As now it is on the reasons them or the preventive mechanisms them. Yes, Doc, you can continue.
Yes, so we don't talk say for check yearly now one important thing. Yeah, no wait so the problem be. But if it's something happen, anything knock the eye or anything happen where your eye just the red or whatever, you are not waste them. Go now hospital because when you go there, then go for solve that problem there where you go with. But also then go for check for glaucoma and pick them up early.
Okay, we get caller on the line. You never said call from Bodi Talk.
Yeah, good afternoon. I call from Peninsula.
Yes, from Peninsula. Your contribution.
I just want to know, like, for example, if you go to pick then you became yeah, it's got something water, attached to the head, so body got to maintain with the terms and conditions, which I for able to put in the focus back, for go to the hospital at one, only get the right treatment, and we get the right to go make the sickness okay again, and I want to go to that something. Thank you.
Okay, thank you very much. 7798191. Now the number we go call and make your contribution inside the program. We'll get another caller on the line. Well, Body Talk. You name where you call from?
Yes.
Yes.
Good evening, afternoon, sir.
Good evening. You name where you call from? Okay, we lost that caller. Somebody they ask about treatments. Go for go hospital at one, but forget the right treatments now other one. I'll come to you, Dr. Fatima, before respond to that, as we'll come to Dr. Lloyd later for talk on the preventive mechanisms, as we don't start for talk about go hospital if something like you go hospital or check your eye regularly. But look at somebody they ask in picking get EI problem, but it's safe for go hospital now one and forget the right treatment now another one.
Okay, so when you get eye problem, Kana Hospital, we get the experts them in Akonox and all over the country. Each district get an eye personnel and ophthalmic personnel. So if you then at the provinces, you then have Fritoya, Kana Connaught. Connaught gets ophthalmologists them, then a doctor the way specialized body eye. We get ophthalmic personnel them where they go able help you. So we get everything what we need for treat eye condition.
Okay.
Kana Hospital.
7798191. Call and make a contribution inside the program. This same number you can call on WhatsApp. So you know go say maybe I no get credits. You can call them on WhatsApp. The same number 7798191. You name we said call from Well Body Talk.
Yes, sir. My name is Rika Buzade, Sami Town.
Yes, Sami Town. Your contribution.
Yes. But what generally call one part the guy is chaff due. Or the other unclear, which very cause that. I don't know if that you want to talk about now or not. Which because the one I see chaff the particles.
Okay. Okay. Thank you very much for your contribution, Doc. That's one. This one they ask if that's what's in at the glaucoma, you they see with one eye the other side now until they see like chaff.
Okay, it's possible say glaucoma can affect our way or late, yeah, that kind of way. But as we tell you, glaucoma where it starts, you know they give sign or symptom. Wait or late, then you side vision, then they go small. Then you want to like say now through tunnel you they look they look through, and when person they pass, we get glaucoma all through the eye. It they work like a robot. If you call and safe, now the whole body now go on for turn. You know go able for just turn like that because now like a tunnel, it they look like I say it they work.
So it not only affect the eye, it affect the body system and the language. Is that the case?
Well, now just because of how they see, you're not sure of waiting the outside that tunnel day. So now that make it work like I say, now anything where they inside that tunnel, now no more is shuffle. You understand, eh? So how it want for you they see where one turn, now safu, you understand, eh? Because it afraid. Now that even when you only hand, you understand, eh? You not just say pass it trust you understand, eh? Before you just move with you just like that. But it is see you. Through that tunnel, they go see something where they far away. You go see something where they near. But anything where they outside that tunnel, you know they see them, and you know safe for me to walk one.
We see the different schools them. We get blind schools them across the country, and these are young people, and some they as early as nursery or primary school. Is it caused by glaucoma? Some of them conditions here as well.
Okay, yes, I want for make you know say na too. Yes, some of them now glaucoma cause them blindness. Now that makes some of them the way they look the eye look clear, not so. But they wonder what make this not a siba. Glaucoma most times now they cause that kind of blindness there. Yeah, I want for make that person talk about cataract.
Yes,
the people like they afraid for go for cataract operation, and cataract operation if you left for too long, you understand, eh? Instead self something that can happen we can make it predispose person to glaucoma. Yeah, because one of the things that when it left too long, it is swell. Water they go inside, it is swell, and when they swell, like I tell you about the ancients, that angle, it dey become shallow because the cataract dey take much of that angle, you understand, eh? So it dey restrict the way how water wan for flow go to that sifter wey dey drain, so that dey can cause the pressure for build up. You no dey know nothing o. All that day na the cataract normal you just dey see, I no see fine na jege, but I dey wait, I dey patient, you understand. So tey you go make so tey by the time wey dem go pull the jege, if the glaucoma don damage the nerve, na for nothing, you no get for see. You understand? So these are the things dem wey make we dey try for talk say not to necessarily say glaucoma we gree say e no get signs and symptoms, but when you get eye problem there go for eye check, because by dem checking that day dem go help you bamba, yeah, for solve that problem dey, and also pick up glaucoma at early stage, and if dem pick am up e go prevent, you understand, you blindness bamba, yeah.
077981981 na the number for call and make a contribution inside the program Well Body Talk. You name it, we said call from Well Body Talk. Good evening, Well Body Talk.
Good evening. Mr. Commander.
Mr. Commander, your background not clear. You can drop the call and call back later, please. The background area echo. We'll get another caller on the line. You name it, we said call from. Yeah, you name it, we said call from.
I call from Gloucester, Mohammed Sise.
From Gloucester, your contribution.
Yes, sir. No, this question you look funny. When don't you go to posting eye? When you see the dirty, it lost, you know they come out, but it lost inside the eye. What you want to tell the eye, we don't you can't post it, can't blow up, we will do it, it says not covered, it's inside the eye, lost. What I don't you can go back?
Okay. No problem. And no question we need to ask now we will see funny because now what your concern we want get from you. Doc, there's not one. We I don't know whether Dr. Fatima, we've still got this caller on the line. Hello?
Yeah?
Yes.
So you got the question, eh?
Yeah, we get clear one. You can go offline now so other people will able get opportunity for call.
Okay.
Yes. This the program now Well Body Talk. This one say dirty can settle na eye, then say can't blow for me, then blow it go. And you don't know who's saying to go. When I can get them complaints them at the center, Dr. Fatima?
Yes.
Okay.
We can get them complaining there a lot. So man can say now woke up in the walk, some dirty just cancer me eye, and then blow am. And they feel like sansan still in the eye. Or sometimes you say then the eye begins scratch. Then complaints then they can come, but wait till we can do. First line, where dirty go na your eye. It's a guy for fan very clean water. You can get your packet water, boss and small, you irrigate the eye. That means you turn on the eye, you irrigate them. No rub them. No rub the eye. Irrigate the eye, use the water, you wash the eye with the water. Wash them fine. Use clean water. Then one step we go able help you in a house. No rub the eye or you say person can't blow them.
Okay.
Yes.
7798191. Call and make your contribution inside the program Well Body Talk. And this number same way so they on WhatsApp. You can call them on WhatsApp so you know go say I not get credits for call and contribute to the program. Hello, you never said call from Well Body Talk. Hello. 7798191. Call and make a contribution at the program Well Body Talk with the country from 98.1 FM. We can drop you message on 7798191 or same way so go to we Facebook page and contribute to what we they discuss na the program. And if you just join we they listen to Well Body Talk where they come to you from the Society for Radio Democracy 98.1 FM. Today we talk at glaucoma blindness. How can it be prevented? And Doc, as we wait for more calls, them if we will able to accommodate because we not get better them again, we take this one at the program. You never said a call from Well Body Talk.
My name is Alpha Kamara from Mambolo.
Yeah, from Mambolo, Cambia. Your contribution.
Me waiting it out me because some example when something enter my eye, if whether I did the eye cup or not the eye, whether if it's good or bad, I don't know.
Okay. Let's thank you for a call from Mambolo. Okay.
Thank you, sir.
Okay, thank you very much. Doc, then they ask if something enter na the eye, if you put eye drop there immediately.
Okay, so wetin we sister just talk about now important thing. When something enter the eye, the first thing we dey encourage people for do na for wash the eye. Wash the eye boku tell with clean water wey you get mind drink. Na him na the best thing. That one way for say person can blow the eye, person just start to put eye drop na the eye wey you sometimes you no know the eye drop. Sometimes na that eye drop wey dey talk about wey get that steroids, that corticosteroids wey dey cause pressure for go up. You see, all you go feel say na good you dey do, and some that medicine dey wey get that steroids, wey you put am, you dey feel cold. The eye dey if e be red, e dey stop for red. You understand? So you feel say you glady. But if e say na something wey get infection, wey get germs don go inside the eye, that medicine dey e dey make the germs glady because e dey boku, e dey burn more pikin, and e can damage the eye, e can burst the eye because of that medicine the way you put so we dey encourage person say wash the eye and take your time, calm na hospital, let them check you fine. Na that make the hospital dey on side, and na master sabi people learning na then districts and the you go wey train how for pick up glaucoma, and all the other sickness, then they know how for treat am, and wey the stage wey dem for refer, and they go if na for refer dem go send you calm so that we go able for help you. The treatment for glaucoma, e be medicine, e be surgery, even laser treatment sef dey, although we only wey we get now not right now e get small problem, the laser, but we dey do the surgery and we get the medications dem. Na true say the medications dem there, na that make we dey encourage people dem for calm and willing for do the surgery, because the surgery e can help and e cost effective. That mean say e better when you look am the long term. When you do the surgery na one off, or sometimes we can get cost for revisal 1 or 2 times, but e no mean compared to the medicine for the rest of your life.
Okay. Plenty thank you for joining me in this edition of the program Well Body Talk. We never will pick any calls again because time no dey now we favor again. I come to we other studio guests. We now Dr. Fatima Kamara from the ophthalmology ophthalmology registrar from the ophthalmology department at the University of Salon Teaching Hospital Complex. We don't talk about the treatment the una they give and also the way una they handle the case where they come to una. As somebody from this department where they deal with TI, what in I advise to people where they listen and view on our Facebook now?
Okay, so my advice to my people out there is where you yai at, you yai red, you yai the scratch. Do ya no go na pharmacy, go buy medicine, can na hospital. Come na hospital, let them check you yai. Because it can be said the medicine where you go buy na pharmacy, na inga for go cause the glaucoma we go pull you yai bambai. So can na hospital. And even you there, you yai know the art, you yai no get no problem. Take your time. Once every year, can get an eye check. Okay? Can get an eye check. Then they go help you, then go screen you for glaucoma. If you no get time, it's fine. But if you get time, then go pick them early and help you.
Most times na the rural setting where somebody is sick, then they boil medicine and then they hit the body and then can cover you with lapa. They can say, oh no PIO, no. Then they get any impact on the eye.
Yes. Imagine then go hit you, then go cover you with blanket with heat. You dey feel an eye even when you lock your eye.
Yes.
And the eye no need heat. And waiting at the advise me people is not allow them put country medicine na your eye. That country medicine they can get tumbu them inside where they go pull your eye bambai. It can get something where ash to the eye. Like acid, you put an eye, it dey pull your eye. So do ya, lo no put country medicine at all na we eye.
What about if your eye red or they say take salt water, so come you open your eye panam?
Now, like what you able to drink salt water? No, because it irritates you. Now the same thing when you put salt water na your eye. I know then you say we person get Apollo open your eye inside the salt water. No,
Yes.
it dey pull your eye. It dey pull your eye. So you know they use salt na the eye.
Okay. Plenty thank you for we not joining me in Saturday edition of the program. I hope say the program interested to now all.
Yes, I appreciate
And
so much.
I
Thank
guess
you for
we
having
listeners
us.
themselves enjoy the program because the calls them we can inside and they learn plenty from them. And to listeners, I hope say my expert in our studio be able to answer to the questions they want to ask inside the program. And next week again, not for sets because we, as the program they go on, we don't get we questions them for next week, and the winners them what you for win, and you will win today. The credits they come now you full after the program, and we want to apologize to the one we win last week. We say not receiving credit. We send them, maybe we missed the number like how we want miss and today. We apologize for that, and maybe somebody will call now the program because now the phone we use again for take the number. In don't win, in don't get the money, even we not be win. But we apologize for that, and we still open up for sponsorship because the number of calls where they come will not get that amount of money for give. But we're willing for give more so that people go continue for pay attention to what we talk now this program and learn from as part of your own contribution. And we partners them with our University of Salon Teaching Hospital Complex for the give we experts them for Canada's program always. Today we talk about glaucoma blindness and how it can be prevented. I've been get two experts then at the studio. I've been get Dr. Lloyd Harrison Williams, consultant ophthalmologist, and also Dr. Fatima Kamara. We come on at the ophthalmology, we're ophthalmology registrar from the ophthalmology department at the University of Salon Teaching Hospital Complex. Plenty thank you for joining at the program.
Thank you.
Now this edition of the program go left.
Family owner, thank you.
Okay, thank you very much. Now this edition of the program Well Body Talk go left. Plenty thank you to my producer Karifatu Conte. We produced the program, and plenty thank you to we partners them University of Salon Teaching Hospital Complex and to we experts them. Plenty thank you to Mary Kamara Bangra. We make una see we live na Facebook and DJ Caps for make una get we live and they will pick una calls them. So till then, Musa Kamara they say have a wonderful day. Bye bye.